So again, good morning, everyone. So today's presentation will be about best practice champions mobilizing action through building competency. It's a great pleasure to introduce you to our speakers for today. Javier Punia is a registered nurse with a Master of Science in Nursing from McMaster University and expertise in palliative care. Javier has worked at the Registered Nurses Association of Ontario, or RNAO, since 2020 and as the Implementation Science Manager. In her role, Harvier leads enhancement of the curriculum for the Best Practice Champions Blended Learning Series and Best Practice Champions Competencies Framework. Collaborating with RNA colleagues, she also co-facilitates a blended learning series. And next, I'd like to introduce you to Catherine Wallace. She's a registered nurse and previously a registered midwife. Catherine has worked at the RNAO since 2013 and is currently the senior manager of the implementation science team. Catherine was the project lead for the Leading Change Toolkit development team and a co-author of the Social Movement Action Framework. With RNA colleagues, she supported the development of the Best Practice Champions Competency Framework and the Best Practice Champions Blended Learning Series, for which she also co-facilitates some of the live sessions. So welcome, Javier and Catherine.
Thanks, Patricia. And good morning, everyone. Excited to be with you and talk to you about champions and our new blended learning series, etc. So yeah, who are champions? Mobilizing action through building competency, really focusing on what do we need to be effective as champions. So what we're going to talk about this morning, we're going to just talk a little bit about who are champions and our best practice champions network. We want to introduce you, if this is new for you, our best practice champions competency framework, our new-ish, we released it in October, our Champions Blended Learning Series, and with that, a fabulous new resource library, and then a little bit about calls to action and your next steps. So our Best Practice Champions Network. So we are, as you've heard, the RNAO, the Registered Nurses Association of Ontario, the professional associations of RNs and Ps and student nurses, as well as Friends of Nursing in the province of Ontario, Canada. And I suspect many of you are joining us from Ontario. If you're not, let us know in the chat box. And we are, as the professional association, we provide a strong, credible voice for the nursing profession to influence and promote healthy public policy and clinical excellence. And the clinical excellence piece we do really through our BPG, our best practice guideline, and our best practice spotlight organization knowledge movement. These are signature programs of RNAO and what we are going to be focusing on today. So our BPSOs, these are organizations, and I suspect many of you join us from BPSOs, healthcare and academic organizations, including schools of nursing, and as well, we have some social organizations, and they have a partnership or work in collaboration with us to implement and evaluate multiple best practice guidelines, as well as achieve other important deliverables. With the goal of this program to influence the uptake of guidelines to enable practice excellence by the implementation of best practice recommendations and positive client, organizational, and health systems outcomes. So seeing the impact of BPSO across that micro, meso, and macro lens. Now, we're very proud and humbled about the reach of our knowledge movement that is BPSO, beginning in Ontario, Canada. But as you can see from this map, it extends globally to many, many organizations. And again, these represent academic and service organizations. And as of today, you may be aware that this map will need to be updated as our CEO, Dr. Doris Grinspan, is today in Mexico signing an agreement for a new school of nursing and new hospitals to join our BPSO knowledge movement. So as a nurse working at RNAO, who's worked on some guidelines myself, really exciting and humbling to think of nurses and other healthcare providers using our guidelines here at home in Ontario and far, far away as well, really speaking to the reach of RNAO, to the reach of nursing, and to evidence-based practice. So we do have this map on our website, as you can see from the QR code, but again, it will be updated as we continue to expand the reach of BPSO. And I suspect that our CEO, Dr. Goris Brinsman, will, at her presentation, talk about this, our BPG program model. It's an integrated model and is really what makes RNAO's offerings so unique and so powerful to our end users. You'll see that there are three pillars: the guideline development, the processes used to create um, best practice guidelines, of which we currently have 50, soon to have a 51st one, as we'll hear in today's presentation from Javier. And those guidelines are developed according to international standards using GRADE and GRADE CIRQUAL. But we don't stop at guideline development. We continue beyond this. And really, perhaps the most important of these three pillars is the dissemination implementation pillars, in which then guidelines are adopted and integrated into different sites and organizations. From there, and in using that implementation, of course, we have different approaches to support that, as described in our Leading Change Toolkit. And that includes our social movement action and knowledge to action framework. We'll talk about those in a few minutes. And then that allows us through implementation to be able to monitor and evaluate the impact of guidelines, and then be able to see what positive impact does it have for those we care for or support, ourselves as providers, the organization, and the broader healthcare system. Again, this is working at those micro, meso, and macro levels. And we see that also in the implementation pillar, focusing again on dissemination, implementation, and sustainability. And so you can see that there are three levels to this pillar that are at the micro, meso, and macro levels, recognizing we need different strategies for each of these. So we've highlighted today our best practice champions. This is the one at the micro level. And it recognizes really that change starts with individual who have the training, the knowledge to be able to implement best practice guidelines. You can see that we offer a number of other offerings at the individual level: fellowships, our ACPF, a number of resources and professional development. And then at the organizational or meso level, the BPSO and our BPG order sets, and also our RNAO clinical pathways as well. And then at the system level, again, we need different strategies, and you can see there are a number of different strategies that we use to support the implementation of best practice guidelines, ultimately leading to lasting improvements in healthcare. So our history of champions is longstanding at RNAO, with the BPG program starting back in 1998, 5 guidelines produced by 2002. And by 2003, we had our first edition of the toolkit, recognizing the importance and value of implementing best practice guidelines. Again, it's not enough to create guidelines. We need to implement them and then ultimately monitor and evaluate them and sustain them. So this concept of champions, really recognizing it's individuals that make change, really applying that social movement approach to change, a people-led approach to change, way back coined in Champions in 2001, and really wanting to look at how can RNAO best support capacity building of champions. And so we've offered champions training since 2002. And all of this detailed in the book, Transforming Nursing Through Knowledge, available both in English and in Spanish, published in 2018. So we define a champion or a change agent as someone who challenges the status quo and believes in change. So it's somebody who recognizes that the current state must continue to evolve and develop as new evidence presents, as new evidence is published in guidelines and other knowledge tools. To be effective, our champions need knowledge, skills, confidence, the ability to put ourselves out there, use that agency and relationships with others to be able to collaborate, to plan and create change, and ultimately to create goals and success. So we can see there's an emphasis here on collaboration, on working with others, and we'll hear that in terms of one of our competencies. In our blended learning series, we structure the content according to planning for change, making change happen, and sustaining change. And in the very first lesson of planning for change, we talk about that change starts with you. That change starts with the individual champion who wants to take on, embrace, promote, advocate best practice guidelines and using evidence to inform best practices. So, really emphasizes the role of champions as individuals, and then ultimately, though, recognizing that change builds with you and with others, that we must work with others in order to be most effective in creating change, and that we can never have too many champions. The more individuals, groups, organizations that we have that are embraced in this knowledge movement, the more effective we can be. And we see, again, as we looked at the map, the uptake of our RNAO best practice guidelines globally in academic sites, as well as service and social organizations. And to use implementation is to use the frameworks of social movement action and knowledge to action frameworks. Our social movement action really emphasizes people getting involved in change. It recognizes that our champions as change agents are leaders in change, and they must find ways in which to get others to engage in that change process as well. So that's that emphasizing that change builds with you and others. And our competencies reflect that as well as how can we be most effective in gaining others' interest, motivation in order to adopt best practice guidelines. And then in addition, we need to understand the knowledge to action framework, a framework developed by Dr. Ian Graham and colleagues that focuses on what's the process of making change? How do we actually plan, make, and sustain change? What are these action cycle phases? And we incorporate both of these frameworks into our blended learning series and use these to inform what are the competencies of our best practice guidelines. So I'll turn it over now to Harveer, who's going to talk more about the competencies and our blended learning series.
Thanks so much, Catherine. So we wanted to start by kind of posing a question, and you can reflect on this, and we'll talk a little bit about it in our Q&A period towards the end. But start thinking about maybe if what motivates you to be a champion, if there is an inspirational champion in your organization that you look up to, somebody you admire, and starting to think about what are those characteristics that we admire and look up to, because that's really one of the key questions that set the stage for the work that we've done related to champions competencies. So to introduce the best practice champions competency framework, we'll share really what this framework is, why we developed it, and how you could use it in your organizations and in the work that you do on an individual level as well. We're very proud of this framework. It helps to really outline some competencies, to compile them in a way that we can clearly outline what knowledge, skills, attitudes, and behaviors really make effective champions that can create change in their organizations, and really help to outline the role of champions. So when you're in your organization, if you're asked what a champion is, or you're asked what do champions do, the aim and hope is really that this framework will help you to really outline your role. So again, the goals, or our why, was one, to really outline the responsibilities, the different competencies, to really ultimately detail the role of champions. Research, of course, shows that once you have clear role clarity of your role, it enables you to be more effective in your role and also grow within your role. And ultimately elevate the impact as champion. So we wanted to really create this so that champions can really elevate their impact, create the most impact as possible within the change process, of course, using those key principles of both frameworks that Catherine just mentioned. We also wanted to revise our best practice champions curriculum. So we wanted to build a curriculum that's competency based. So once we know, what exactly is the role of champions, what helps makes a champion effective in their role, then we wanted to build a curriculum to support our champions in gaining those competencies. To lastly foster professional growth. So within your organization, creating change is, of course, key and ultimately the key purpose of the Champions Competency Framework, but also providing a standard for self-assessment so that individual champions can reflect on their journey, see what are areas that I need to perhaps improve and gain more experience in, and how can I possibly reach out to others for support, what opportunities are out there for me to build this competency, to really foster that growth mindset was also one of our key goals. So this is our competency framework. So after triangulation of various different resources, so doing a deep dive into literature, doing a deep dive into the Leading Change Toolkit, and doing some focus groups with champions, we synthesized all of those results and developed this framework that highlights 7 roles of best practice champions to effectively engage in the change process using, of course, social movement action and knowledge to action principles. So using those guiding frameworks, what roles do champions encompass that allow them to really successfully engage in change? And then for each of these competencies, you'll see in the tool that we'll highlight for you, there's also a series of performance statements that are associated with each role or competency that help outline what are some actionable things that highlight us enabling or doing that role. So we also look into what individuals do within those roles. But to just say those out loud, so we have champions are advocates is one of them. So aware of, passionate about best practices, upholding them, promoting them. We have champions are collaborators. So we really found that in organizations, champions are promoting diversity, inclusivity. They're creating that sense of belonging within teams. They're engaging with other stakeholders. They're also communicators. So they're looking and seeking and integrating feedback from others. They're content and context experts. So they have a bucket of expertise. Often that could be historical context. So long-standing history. Perhaps you've been within your role for years within the organization. So you have that context expertise, or the content piece of maybe you've engaged in change multiple times, or you're an expert in wound care, for example. So that really content expertise piece. Facilitator refers to champions doing those actionable things to create change. So whether that's hosting meetings, whether that's hosting events, the part about operationalizing the change is what we refer to when we speak to facilitator. And then we have mentors that really help guide others in the change process. So we found that champions are often the people that others look up to and go to for support. And they're really leaders as well. So whether that's informal leaders working frontline or those informal leadership positions, but champions are influential peer leaders. They're role modeling that practice change for others. So those are really the 7 roles quickly. Of course, they can be broken down further, but just to give you a quick overview of those 7 roles. And then I mentioned that there's a self-reflection scale. So each of those are associated with different performance statements. So I'll highlight this one here, for example, for leadership. So it tells you what refers to a leader, and then it gives you some examples. So this is where you can self-reflect and think, am I doing this in my practice setting? Is this something I could work on? So for example, for C there, it says develop leadership knowledge and skills to support and spearhead a practice change. So committing to ongoing professional development. So if that's something that you didn't really quite associate before, make that connection, it clearly highlights that for you. And then it gives you an opportunity to reflect. And you see the scale 1 to 5, which refers to these stages. So perhaps you're feeling you're a novice. I have those knowledge and skills, but I really do need some ongoing support to put that into practice. Or perhaps you're in the more 3, 4, 5, which is I've done this before. I'm really gaining those skills. I've been a part of a change team before. And if you're at the expert level, perhaps you're acting as a mentor for others. So it gives you the opportunity to clearly think about what it really means to be an effective champion, and identify opportunities for growth and seek out opportunities to help build your experience and build your competence. So we have perhaps a little bit of time. You can just maybe put in the chat box of or think about it yourself and reflect on for leaders this competency that's 1B, which acts as an influential peer by consistently role modeling the practice change to reinforce knowledge and skills. So, for example, applying new policies to practice, using guidelines, providing feedback and reminders to peers. You can think about where would you really fall on that scale. Um, and perhaps you need a little bit of time to read through this skill, and we'll show you where the tool is found. But just to get you into the practice of thinking about how would you assess yourself and think about yourself in reference to the leadership competency. Okay, and then we're going to talk about some strategies. So once you go through the self-assessment, then perhaps you want, okay, so what are my next steps? How do I develop some content and context expertise? So, of course, applying competencies in clinical practice, you can go through the tool, you can identify some areas for growth and start applying them in practice. You could also go to guidelines. So we have 51 plus, Catherine, I believe now, guidelines that you can refer to help start building some of your content areas. So if you're looking at developing and sustaining nursing leadership or interprofessional collaboration, there's guidelines for that. There's also our 51st best practice guideline, which is clinical practice in a digital health environment webinar. There's a webinar that's actually being hosted on March 27th. So we invite you all to join in on the webinar and learn about this new guideline. And it'll go over again the purpose and scope of this guideline, next steps for kicking off implementation of this guideline. It is really important, especially in our current digital health environment, of course, in healthcare. So lots of different ways to gain content expertise for sure, and guidelines are a great place to start. And then there's things like the action piece of it. So perhaps you're not quite ready to join a change team meeting, but you can observe a change team meeting. You can talk to a colleague who's been part of a change historically to learn a little bit more about what that process would look like. And those are great ways, again, to look for those people that we look up to, that we inspire to be like, and start gaining some experience. We can observe peer leaders in action. So, what competencies do they demonstrate? Is there someone that's a really good public speaker? Is there someone that's a really good collaborator that has, again, been part of multiple change teams? And what competencies do we admire about them? And how can we learn from them? Something else that we recommend doing is just following change agents on social media for inspiration. This is a great way to stay connected with your organization as well as the healthcare community, to learn from others. So some people that we here at RNAO encourage and our champions follow is Helen Bevan is great implementation science expert, sharing lots of tips and tools and through X. Of course, the World Health Organization, the Gritty Nurse Speakers podcast is a great pair of nurses that often are speaking to equity, diversity, and inclusion in healthcare as well. Karima Velji is sharing updates, and Lee Chapman about current state of important matters in healthcare and advocacy going on. So great things, great people to follow to stay in the loop with things, as well as inspirational change agents, really. And of course, our CEO, Doris Grinspin, is there as well to keep you in the loop with things. Okay. And yeah, we encourage you to join RNAO if you're not a member already. You gain access to, of course, all of these different webinars and events we have, lots of different benefits as well. We have being a member, I can speak from my personal experiences how I got involved with the RNAO. I've been a member since I was a nursing student, was involved in different chapters throughout my years. And it was a great way to really engage in a community of passionate nurse leaders. like-minded individuals that really help you grow and think about things in a more critical manner. So recommend that to everyone, for RNs and NPs as well. And you can scan that QR code to learn a little bit more. Okay, so I think we have some time now to think about and maybe have some discussions. I know there were some great questions in the chat box, so we'll get back to them after we go through maybe a couple more slides. But excited to hear from you about just what your next steps are. Are you involved in practice change? And we'll get wrapped up about perhaps what strategies appeal to you most. And can hear from you in our Q&A period in about a couple of minutes. Okay, so the blended learning series will give you a quick little lowdown, high level of what it is. So how to become a champion. We have 2 self-paced on-demand modules. They're related for planning for change, making change happen, and sustaining change. So in those modules, you really get that foundational content. And then we have 2 live sessions that support each module. So the ideal is you kind of do one module and then you attend the live session, you do the second module and you attend the associated live session to really get some of that practice piece and hear from others. The resource library Catherine mentioned is on-demand library with lots of different job aids. And Champions Community is something we're working on that hopefully we can share with you soon. So again, the breakdown is it's a total of 6 hours. Module 1 takes approximately 90 minutes, we're finding. The live session is also about 90 minutes. Then we have module 2, each has lessons for making change and sustaining change. And so all 4 components are about 90 minutes, so totaling about 6 hours. It's self-paced on demand. So you do the modules self-paced, and then you sign up for a live session date that works for you. And the resource library you can access, so you have to actually register for the blended learning series. And even if you don't go through the modules or the live sessions, you gain access to the resource library immediately. So there it's divided by planning for change, making change happen, and sustaining change. And then you can go through and look at the different job aids that are there to support you. And lots of different job aids divided into different types of templates, worksheets, resources. So for example, this one's if you're reaching out to others for support, it goes through some guided questions and what are some good questions to ask people. So for example, what is the concern? Why do you feel change is needed? So the idea is to really give you some real life tools that you can use in your practice settings. So as I said, some reference guides, tips for facilitating your first team meeting, how to conduct a gap and opportunity analysis, so a how-to guide. And this is the page of how you can actually go in and register. So how to become a best practice champion, the blended learning series, the e-learn course is being updated. So we will keep you all posted. It's still available there for you, but some of that content from the blended learning series, we would like the competencies, we really want to pull into the e-learn. So that's currently underway in a project that's going, but the blended learning series is available for you, as is the e-learn. Okay, so we're not going to go through any of the module 1, but hopefully you got a good idea of it. And it's not moving forward for me. Okay. So we'll go through perhaps we'll go through some of our Q&A together as a group, but just some upcoming live session dates. So if you've already done part 1, then you can actually register part 1 and 2, then you can register for part 4, which will be March 26th. If you want to start from part 2, just to register for our blended learning series, do the module. Our next one is in April. Our next live session is April 4th and April 18th. So you'll find that there's 2 live sessions each month. And of course, if you can't attend one of them, you can attend next month, but they're always going monthly for now, is how we're doing it. And we wanted to end off with just some important calls to action for you. So if you are already existing champions, we encourage you to sign up for the Blended Learning Series to gain access to the resource library, to gain access to some of those new tools available to you and go through the modules just to update your skills. If you are formal leaders, we encourage you to support your staff to register to complete the new Best Practice Champions course as completing it yourself. And really looking forward to just hopefully these resources will help support you as champions and support other champions to gain ideas about how to get involved with change. And the job aids especially will be helpful to start applying some of those things that you're learning into practice. Okay, so that was a quick rundown, and I'm excited to see that there's lots of different questions for Catherine and I in the chat box that we can perhaps start addressing. So thanks, Patricia.
Thanks so much, Catherine Hervier, for sharing the discussion about the best practice Champions competency framework and the blended learning series. So there's a couple of questions in the chat, and I think you've seen some of them, but I'll bring them up to you. So first question, can you give any advice when a BPG is dated back in 2014, for example, for us like an older BPG? Do you have any advice for that, Catherine Hervier?
Do you want to start off, Catherine?
Sure. Yeah. So we continue to update our best practice guidelines. So do have a look on the website. The website has had a major facelift and will indicate when the guideline is up for revision. We do have a small number of guidelines that have been retired, and that's because the topic area is no longer one that is maybe relevant or current in clinical practice, or there is another associated